Hi, my name is Daniel Sokol. I wanted to talk a little bit today about coming to therapy for changing your relationship with opiates, with substances, with alcohol. When patients come to me, they often don't straight out say, I want to change the relationship I have with opiates. I want to change the relationship I have with alcohol. I want to change the relationship I have with substances. It's usually an underlying tension of things not going well, feeling overwhelmed, feeling like you need more and more, or coming to a realization, this relationship I have with this substance is impacting my life, my work, my relationships with family, friends. Therapy for this conflict is something that's really hard to take the initial step to do. It is something that has a huge taboo attached to it societally. You know, you're an alcoholic, you're a drug addict, you're this or that. These are the things that get emblazoned in one's mind and that they think of themselves. And it's really difficult to say, to speak of, and to allow it to exist outside of one's kind of internal thinking or internal world. Therapy can be really helpful in terms of having a sense of how the relationship exists and what the relationship developed from, exists as, and why it's there. Because someone gets addicted to something not only for the classic kind of genetic neurological disposition to an addiction, but also because there's something in there that's subsided or placated, whether it be anxiety, whether it be fear, whether it be social situations being easier, whether it be the culture of friends, family, or the way one was brought up in having a relationship with something. The purpose of coming to therapy for it is not to force abstinence of a substance upon someone immediately and throw them into rehab, but to really significantly evaluate and significantly work towards what it means to have that relationship with alcohol or opiates or something else, how it's impacting your life, and how it needs to change and what can be done to change that. I see a lot of patients where this is a secondary item tied to anxiety or depression that's brought up very frequently. But it's also something that's really uncomfortable just to come straight out to therapy for. And that's okay. But I thought I'd make this video to really give permission for it to exist as a reality of why someone might want to come to therapy. Maybe it's in the background of what you're thinking about needing to come to therapy for, but it's a pretty big and pertinent one that comes up quite a bit. So starting the process of therapy involves making the call. The initial intake is not going to be really abusive. It's not going to throw someone in rehab or set a bunch of demands, but it's going to be very real about how things exist and how to work towards making it a little different, changing it, making sure that relationship with that substance isn't what's ruling work, what's ruling your physical feelings, cravings and wantings, or how you organize your social life or your day-to-day to have that need subsided or placated. It's about changing all of that so you can be more present for yourself, more present for the relationships in your life, whether it be a romantic relationship, whether it be friends, whether it be kids, whether it be family, but allowing that to exist, those relationships, those important relationships, to exist on a deeper plane than just kind of when can I get what I need next, or when can I have my next drink, or when can I have my next pill to placate this tension I'm feeling inside. I know these videos sometimes can be pretty intense. I'm pretty straightforward and frank about some of the experiences people have, and my intention is not to overwhelm you, but to basically allow permissibility of these thoughts to be spoken and understood, and to find yourself at a video like this or my site and say, maybe it's time to begin the process of change. And if you're interested in beginning the process of change and you find yourself at my website or my YouTube channel, don't hesitate to reach out with questions, and I look forward to further conversations. I hope you have a great day, and thanks for watching my video. Take care.